Meanwhile, I'm starting the recording now, so I'm just going to say for those watching on the recording, welcome. You're joining the Learning from Lockdown Community Wellbeing Responses to Covid-19 webinar. We're just in the middle of a poll asking the attendees, have you been involved with community wellbeing responses to Covid-19? And the responses now, hopefully, you should be able to see on your screen those joining us on Zoom. So we can see that 53% of people joining this webinar have been directly involved, 25% partly involved, and about 20–25% not involved but interested to learn more or other, which we'll hopefully get the chance to delve into as we interact throughout this evening. Thanks, guys. That's really helpful just to get a sense of who's here. So without further ado, I will move us on to introducing our speakers for this evening to share on this topic. Our first speaker is Karen Creavin, who is the Chief Executive of the Active Wellbeing Society. And we've actually, at the Network of Wellbeing, known Karen for a few years. She's doing incredible work, mainly in Birmingham, really kind of helping develop healthy and happy communities that are living actively and connected to each other. And she, since the outbreak of coronavirus, the Active Wellbeing Society has kind of pivoted their work somewhat and really responded to the strong needs that have kind of come out of the community, and they've focused really on kind of relief support, particularly in relation to food distribution, but also offering different types of things such as online well-being, kind of health and well-being activities, and also a kind of befriending service. So they're doing a range of really exciting things, and I'm really looking forward to Karen, hearing what Karen has to say about the kind of key emerging lessons from Birmingham at this time. So Karen, I'll ask you to just unmute yourself and come onto the main screen and say hello whilst I start sharing your presentation, if that's okay.
Thank you very much, Flo, and thank you everyone for having me here this evening. I'm really excited to be able to talk about the work that we're doing, and I'm really interested to hear the other lessons that there are from the other speakers as well. I feel like I'm in great company, actually. So I'm going to take the opportunity, if I can, once our presentation's sort of sorted, just to give you a really brief context to what we've been doing and what we see, what we're beginning to notice. And for those of you that haven't been to Birmingham or that don't know the city intimately, there are 1.2 million people living in Birmingham. And of those, 408,000 of them live in the top 10% most deprived households in the country. And I'm just going to pause and I'm going to say that again. So in a city of 1.2 million people, we have 408,000 of them living in the top 10% most deprived households in the country. So Birmingham's deprivation is not to be sniffed at. We have a population that are some of the most deprived in the country, and we have particular issues around children's poverty. We're also a really young city statistically. And so you are more likely to be young, poor and black in Birmingham than you are in any other city in the country. There's some amazing things about Birmingham, please don't let me put you off coming. However, it's kind of that backdrop that COVID hit. If I can get you to move on to the next one for me, Flo. Thank you. So as Flo was saying, we've been doing, we weren't typically involved in food banks, but we have been using waste food to tackle food poverty in a sort of sustainability initiative that we were running anyway in Birmingham. We've got great networks into our communities, and as a result, one of the first things that came up that we were concerned about was what would happen to all the people that were being fed through the waste food projects that there are in Birmingham, like the Real Junk Food Project and Fair Share. How were these people going to get fed? So we responded working with about 70 other partner organisations, and you can see the statistics there. As of the 3rd of May, we had 12,000 food parcels that had gone out, and the bulk food orders are other agencies, other organisations, faith groups, community groups and others that are coming every day to collect food from the food that gets distributed to us via some funding from the City Council and donations through, paid donations through from places like Fair Share. I'll just briefly go on to the next couple of slides where they're just some statistics about the other work that we've been doing. As Flo was saying, we've been running a virtual wellbeing service online where we've been doing a range of content mainly aimed at physical activity, but not exclusively. And alongside that, we've also been doing some closed WhatsApp groups for social prescribing and other chronic condition pathways that we were doing some work on. Befriending activities, that's basically where we've set up a telephone line. Initially, we were doing that to take as an alternative to people who didn't have access to the internet, where they wanted to register for food. And really quickly, we realised the importance of offering a wider range of support. So we have 3 tiers of support with different levels of qualified staff. Now this has all been set up in the last 2 months. It was, you know, it really was at lightning speed, but you can see the sorts of support that we've been able to offer there. Lastly, we already had the big Birmingham bike scheme, our distinctive orange bikes. Over 7,000 of those bikes have gone out into the community, free to people in deprived communities, in an attempt to tackle some of the barriers around poverty and cycling. It's a great scheme, and if you want to know more about it, you can see more about it on our website. But we've been able to use some of the bikes that we had in stock to give out bike loans for key workers, which was a really important thing that we've been able to do while transport was so insecure in the city. And you can see a couple of quotes there from some of the recipients. So some of the emerging lessons for us. The first lesson, I think, that certainly that I'm seeing in the city, and I've been talking to colleagues, some of whom are on tonight, about this, is really about the impact of the inequality. I was lucky enough, if lucky is the right word, to see some of the really early stats in Birmingham about where the COVID deaths were happening. I got access. I had a glimpse early in April where our deaths were, and at that point they were in the east of the city, which is the most deprived. And in the part of the city that they were in, it's actually one of the ones with the highest density of BME communities as well. In Birmingham, we saw quite early on what then happened, what's come out as a result of the statistics from the rest of the country, and actually the inequality in COVID, the people that are dying. You know, it's not affecting everybody equally. We're not all, we might all be in the same storm, but we are all in different sized boats. So the inequality that we went into COVID with is then mirrored in some of the results. And the work of people like Professor Sir Michael Marmot in his review of his earlier report, Fair Society, Healthy Lives, gives some pointers in a world where that was written before COVID was even on people's horizons. The usual suspects in all of this are inevitably going to be the worst off, not just in terms of the impact of the disease, but increasingly we're becoming concerned about the impact of dealing with the crisis. And with a global depression on its way, we're obviously increasingly concerned about all of the groups that are already impacted on by the worst poverty. I think what's important in Birmingham that we noticed was that the system response was slow, and I don't think that was unique to Birmingham. I think there are still things that have been set up nationally that haven't really managed to find their flow, and a really good example of that is the free school meal voucher system. You know, 8 weeks on, school children and their families are still not able to access those vouchers easily, and actually that was in direct sort of opposition to the community response, which we saw in Birmingham emerging within the first 24 to 48 hours. And actually, it was probably 2 weeks before the City Council's structure and system set in, and we actually had an emergency response that we were working with. Now, that doesn't mean people weren't doing things before those 2 weeks, they very much were, but it felt like government and the system struggled to actually make things happen on the ground in a way that communities were able to step into. And that's really important, I think, in terms of pointing to a way forward. The other thing that I would want to just really bring out in my piece, and I won't labour this too much, but not all communities are equally resourced. So in Birmingham, as we would expect, we've seen some of the best community responses in the communities that probably need that community response the least, because that's where the capacity is. And so some of the more deprived communities really have struggled to be able to do anything more than survive. And continuously, I think the system is shocked at the level of need that we've seen in the city. If we can move on then to the next lesson that we're seeing, and we had a strand. We decided to do this really early on. A strand in our work was going to be positive reinforcement, so sort of replaying to the communities the good work that was coming out of them. It's really important from a self-efficacy point of view, from an empowerment point of view, and also I think it was it related to some of the work we'd already been doing around system leadership and the importance of storytelling and peer narrative. So we've had a whole a combined effort across the city under a kind of unifying hashtag Brum Together, and we've been making sure as an organisation that we're putting a mirror back into the communities in our city, showing them the good work that's going on either in their communities or in communities similar to theirs. And where we can, we've tried to make sure that we're amplifying the positives in all of this. There's an awful lot of anxiety, there's a lot of rumour and mistrust. Lots of people's experience of things like a surveillance culture or this kind of control isn't positive. And so it's been really important that we've tried really, to make a really positive effort to then reinforce back those messages back into the community. And we've talked about the importance of empowerment. We've had, as communities, we've had an enormous amount of control either taken off us or we've given it up. And then for those who are really vulnerable, the idea that food's turning up that somebody else even chooses for you, and there's a lot that's disempowering in the way potentially that our organisation is working. So in an attempt to kind of add energy back into some element of re-empowerment, we've been looking at making sure that we play back to communities when they've done work that's of importance and positive. Lastly, then, I think my last observation would really be about the sharing economy and the significance of that. The community response that was really quick, and a theme within that that's continued has been about people sharing the resources that they have. We saw really early on, there were lots of images in the media of people hoarding toilet rolls, for example, but actually in Birmingham, what we saw really quickly was people stepping in to share what they had. And actually the requirement of the state or of us as the voluntary sector was to help facilitate that. And I've seen that continue on and on. And we're looking at initiatives that we already had in place, like our library of things, or as we call them, our share shack. We're looking at turning that into sharing supermarkets or share shops, because actually we've realised that people are really happy to give as well as to borrow or to have. And so that's one of the things we've been able to do at speed. And I think if you think about the trickle-down economy, and the idea that you would have economic development in a traditional sense, we know that already doesn't work for those at the bottom. And so, traditional models of economic development really aren't going to work in this time of crisis, and don't. What we've seen actually, though, is a surge of people wanting to share what they have. I think what's really important is that practices some of the skills we need for democracy anyway, but actually there are democratic deficits in some of our communities, and we need to support the work around building trust so that actually the sharing economy is something that people aren't suspicious of or are able to participate in fully. The last thing I would just want to say, I guess, in all of this is just in terms of the work that we're doing, is that the unit of place has changed. Where we were working on a place basis in Birmingham and in other parts of the country, we've seen that shrink, and people are working differently or feeling differently about where they work. I suppose we as an organisation have had to refine what we were already doing to fit new opportunities, and I struggled with the word opportunity, because ultimately this is a negative thing, but there are opportunities for our communities in all of this. We need to build flex and resilience into the way that we work, and then the way that we work with others. We need to witness and mirror back the lived experiences, and we need to stay with communities and support their resilience. And I think those are my observations at this point. I think there's loads more coming down the pipeline that we'll have to help communities to deal with, and I think Wellbeing itself has a lot to offer as part of the solution for us internationally even. I'll leave it there.
Thank you so much, Karen. That was really informative and helpful to hear those kind of three lessons that you've drawn out about the issue of inequality that's coming out so strongly, about the power of storytelling and what difference that can make, and around the kind of sharing economy. Just to very briefly mention, I was saying to Karen in preparation for this that we're running these webinars every 2 weeks, and our next webinar will be on the sharing economy in 2 weeks' time. So Yeah, brilliant that you mentioned that now, and we'd love to delve more deeply into that next time. We'll make sure to send a link out to everyone that's joined us this evening. Next I'm going to hand over to our next speaker, Berman from Carnegie UK Trust. Just to say, for those that have joined us a little bit late, you are on the Learning from Lockdown Community Wellbeing Responses to Covid-19 webinar. We've just heard from an excellent presentation from Creavin from the Active Wellbeing Society. My colleague Roger is keeping an eye on the chat box to look at questions that are emerging throughout this discussion. So if you've really enjoyed Karen's presentation and got some burning questions, please do put those in the chat box, and Roger will be kind of summarising those later when we come to the Q&A. But for now, I'd like to take the chance to introduce Ben as our next speaker. So Ben is the Senior Policy and Development Officer at Carnegie UK Trust, and he does a lot of work focusing on kindness actually, and what we can do to create the conditions for kindness and kind relationships in communities and in organisations. And during COVID, the COVID crisis, Carnegie are talking to people in different places across the UK and really taking that opportunity to listen to communities, to understand what's changing, where communities are coming together in response, where this hasn't been possible and where the gaps are. So yeah, it's really exciting to hear from Ben this evening about that ongoing work and some of the emerging lessons that are coming from it. So I will hand over to Ben, and just to mention, Ben and Tracy, our next speakers, are going to speak without slides, so you can just, yeah, you'll be able to see them directly on the screen. So I'll hand over to you now, Ben.
Thanks, Flo, and thanks, Karen, as well, for really powerful presentation, reflections on what you're learning about the response in Birmingham. It's really lovely to know that there's so many people joining tonight, but quite a strange experience to not be able to see you, but hello. I'm from the Carnegie UK Trust, and for those of you who don't know who we are a foundation based up in Dunfermline in Scotland. We've been around for about 100 years, and our remit is to improve the lives and well-being of people in the UK and Ireland. Today we do this through policy and practice innovation, and currently cover quite a broad range of issues. But yeah, as Flo mentioned, the sort of main bit of work that I'm responsible for is thinking about what we can do to build kinder communities, what we can do to embed kindness as a value in our organisations and policy making as well. So we don't deliver services or work directly in communities, but we are connected and sort of work in partnership with quite a lot of people who do that. So my sort of three reflections or things that I'm noticing are very much based on what we're hearing from people in our networks, and I'm just sort of saying this to give you a bit of context, and because I'm sort of being careful not to overstate our understanding of the crisis and its impacts, particularly at a time when it's changing quite rapidly, as I'm sure you're all aware. That said, what we have seen, I think, in our work in the media everywhere is a sort of outpouring of kindness. We are seeing it in our neighbourhoods, in the sort of formal and informal voluntary response. We're seeing it in our, well, I'm certainly seeing it in professional relationships, taking much more time to really focus on the well-being of colleagues and other people we work with. Seeing it in changing organisational practices, and even seeing politicians talking the language of kindness, well-being, even love. And this just feels like a massive shift from where we were 2 months ago, and a shift in what we value. And something that I think feels at the heart of this is trust, which was the sort of first thing that I've been reflecting on. And in our neighbourhoods, I think partly because of this sort of shared experience and sense of solidarity and togetherness, COVID, despite its quite devastating impacts, has given this sort of permission to care about each other, to offer and receive help and support in a way that previously felt risky or uncomfortable. But we're also in our work sort of hearing about this in organisations, how in certain places care and support workers are being given more autonomy, more flexibility to respond to individual needs rather than sort of following rules and regulations, and essentially being trusted to deliver much more human, more relational, kinder services and interactions. The second thing that we'd sort of been noticing is that this sort of trust has been the sort of foundation for much more collaboration and working together in communities of place. And should stress again that this is not happening everywhere, but some of the people that we're talking to have been telling us, first of all, what Karen was reflecting on about the speed of the community response, and how informal sort of community groups, but also civil society organisations were able to respond to the sort of like practical and emotional support needs in their communities because of their deep connections to people and place that have been built up over time. But we're also starting to see this being, in certain people we're talking to, this being recognised by local authorities who are sort of supporting, or stepping into that community space and supporting and enabling communities to provide this sort of support, and essentially working much more closely in partnership and collaborating together. And I guess a sense that this sort of like united sense of purpose that COVID has brought has also removed some of the barriers to partnership across organisations and between organisations and communities that might have existed before. Things like hierarchies of power, territorialism, sort of governance and procedure that quite often got in the way of this sort of partnership and collaboration. And I don't think any of the people that we're talking to are saying that this has been seamless, and we know it's definitely not happening everywhere, but we are certainly seeing that in certain instances, local government and civil society, health and social care and community organisations are working together in ways that just wouldn't have felt possible a couple of months ago. And I think what our sort of hypothesis is that those organisations, particularly local authorities that listened better and placed greater value on engagement with communities before COVID, have been much better positioned to do this, and seen things, sort of research coming out around how that's played out in Wigan, which obviously had a really strong relationship with communities in the past. And the last thing that I just wanted to talk briefly about, which Flo had mentioned, is the importance of listening. And we've been really focusing on this in the past sort of month or so for a couple of reasons. The first is that, despite a lot of talk about the opportunities that this is presenting and some of the positive things that we're seeing around relationships, around people thinking and much more intentionally about well-being, it's not inevitable that COVID will lead to positive, lasting change. And we think it could be really important to capture what's happening now, to understand what we're learning about kindness and relationships and well-being, to try and see what it is that's enabled certain communities to take control and others not, and so that we can use this learning to inform our priorities, to recognise the things that we do want to hold on to from this moment when we do enter into some sort of recovery phase, whenever that might be. Over the last sort of couple of weeks, we've started a sort of community conversation project where we are talking to a range of different people in, I think, 15 different places across the UK to try and track some of this learning in real time. And we're also doing a couple of other things to try and collect stories of kindness and relationships in communities and what's changing. And anybody's interested in being a part of this, would be delighted to hear from you, and I'm sure Flo will share contact details at some point, either on the call or afterwards. Yeah, the second reason that we think that listening is really important at the moment links back to everything that Karen was saying in her presentation around inequality. And we know that community action and partnership working and sharing of power is not happening everywhere. We know that COVID-19 is not affecting everyone equally, and there's lots of people and communities who are not receiving the practical and emotional support that they might need. And looking further ahead, we also know that the longer term effects from employment to mental health and whatever it is are going to be borne more by some people than others. And so I guess we're sort of seeing a real risk that COVID-19 and the way we emerge from this could supercharge the existing inequalities that we have in society. And so it feels really important at the moment to do everything we can to listen well and widely, to try and hear the voices and experiences of different communities, and to understand these experiences and use it to rebuild a kinder and more equal society moving forward. So that was my three on trust and partnership and listening. And yeah, I hope I get a chance to chat to some of you about this over the next hour or so. Thanks a lot.
Thanks so much, Ben. That's really helpful summary to hear those emerging lessons, and really interesting to reflect on the kind of crossover emerging lessons learned from that both Karen and Ben have shared around, from Karen, the importance of storytelling, and Ben and Carnegie's work around listening, and then within that the kind of need to be really aware of which voices are being heard and which stories are being told, and being aware of the kind of power structures and inequalities that can be at play. So thank you so much for sharing. Just to let you guys know, we will go out into breakout discussions shortly after our next speaker, so that you guys will have the chance to share your own ideas with each other in small groups, and then later on we'll have a kind of full Q&A, so any questions that are being shared. I've seen that people have been responding to each other's questions in the chat box, which is wonderful, and thank you so much for doing that and for connecting with each other in that way. Please continue, and then Roger will be keeping an eye on any kind of specific questions for the speakers that we can come back to later. But next I'm going to pass on to our third and final speaker for this evening, Tracy Robbins, who is Head of UK Delivery for the Eden Project Communities team. And Eden Project Communities leads a range of really amazing community initiatives, such as the Big Lunch, which many of you have probably heard of. And in response to COVID-19, Eden Project Communities has actually kind of joined forces with a range of different projects to launch a community action response, which really encourages people to respond effectively, particularly to those most vulnerable in our communities. And so it's really fantastic to have Tracy here with us this evening to share some of the lessons that are emerging from that. So I'll hand over to Tracy next.
Thank you, and I'm trying to be technically savvy and unmute myself. Welcome everybody, and I hate going last. Everybody said everything I want to say. So just going back a step, so I work for the Eden Project in Cornwall, so as a visitor destination, you can imagine that's quite decimated at the moment. But Eden's mission is in fact to reconnect humankind to each other and our natural world, and that is through the power of transformation, bringing in science, art and communities, bringing all those things together and looking at how we can explore and work together towards a better future. So we set that up nearly 20 years ago. 10 years ago, they set up the community outreach programme, which is across the UK, and the flagship, of course, was the Big Lunch initially. But that's because we know that human connection is at the heart of any resilient, sustainability, social action programme. Our connection with each other and nature is vital for building our physical, mental and social health. So Eden Community's vision, I suppose, is a world full of happier and healthier communities where people know each other and neighbourhoods thrive. And I think in this situation that we find ourselves in, some neighbourhoods are thriving and are connecting, and some are extremely struggling. So I thought it was very interesting what Flo said about actually what stories we are hearing and which ones we are listening to, because we want the need to reflect that kindness and those good things are happening. I just wanted to touch on 3 of my favourite subjects, and one of them's not loneliness, so that's my 4th favourite subject. So I wanted to touch on the sort of narrative around permission, those informal connections, and a bit more about barriers. So I'm sorry if I'm going to end on a negative. I do apologise, but hopefully that will help the debate. As I think Ben touched on, and I've worked with Carnegie a few times, permission to me is really important. When Eden Project was looking at actually how can we connect people to each other so that they can form those informal relationships, what we found is people needed a reason. They needed permission to knock on their neighbour's door, and that is why we come up with different activities to try and encourage people to connect, and there's many more than what we do. What I have seen and my reflection from this current situation is that we've had a sustained period of time and I suppose permission in this crisis to reach out and care for each other. So our humanity has been able to come to the fore, and I think that is really important. And I think along with permission, time is equally an important narrative, so that people are at home and able to focus on the people around them, as well as having a sort of overarching crisis that we're all trying to address. I think the thing around permission is, of course, it also gives a space or permission for that darker world to lurk and take sort of advantage of the vulnerable in this situation. And I think we have to always be mindful of that and how we look at that. And that sort of feeds into my next one, because I think that being mindful of those situations is what drives people to try formalise the informal space. So we have always worked, I have always worked, I'm a youth and community worker when there used to be them such things, and I've always done go Helen, and I've always done community development. I am a product of community development myself, and I think those informal connections, that human response, is what I think is overwhelming everybody with the positive stories at the moment, because most of what we see is not that formalised volunteering. I am not knocking that, and it is absolutely key and a lifeline service, but those informal connections are much more sustainable and much more resilient to change. They don't need funding, they don't need regulation, they don't need all the package and bureaucracy that comes with that. And I think that was one of the reasons that we actually came up with a community action response as Eden Project, because when this first happened, we noticed that a lot of people were coming out with what their individual organisation stance was on the Covid-19 situation. They were telling people what they should do as individuals. A lot of people were not saying anything because they were fearful of saying the wrong thing. So we came out and tried to support that informal social action that was taking place, and trying to support people with different assets and tools there. And I think we have about 30, 40 partners that are looking at that and have a view for the long term of actually how can we maintain those informal connections and also support the most vulnerable as we move forward. I think finally, barriers. I think I was on a call the other day I think it was last week, where we were talking about actually for those people who are already struggle to engage, those barriers to engagement have just got a lot higher. So we were coming from the perspective of people with dementia, people with hearing loss, people that needed routines and patterns. And actually there are a lot of people out there who are losing their ability to socialise, they are losing skills in which they were just developing, and that lack of routine and that need to go out is actually seeing a lot of people shrink inside themselves and those barriers coming up. We have heard about lots of positive things, but we have not spoke about fear, our aggression. My sister is a key worker, and when going to the shop early was spat upon because she could go to the shop early. And this is in a deprived area where food is scarce and fear is running high. And we rarely hear, and we don't want to hear about those things. We want to hear how human nature is actually going to come to the fore in these situations. And I think we must remember that the experience is not positive. There will be people that have come into this situation impoverished, lonely, depressed, with whatever label or condition you wish to give them, and they will probably be lucky to survive this situation and get through the other side. I think what we will also see is a lot of loss. And one of the interesting things I have been chatting about is actually, I was talking to my colleague, I'm sure she won't mind, Juliet, and she was really worried about her mother, but her mother has such a social life now in lockdown because people ring her neighbours do her shopping, people are there, her neighbours are there, and they're not all driving to work, that actually she's more fearful now that her mother will experience loneliness when those people go back to work. So actually there's going to be a sense of people feeling bereft, that they have lost this connection, this we're all fighting the same thing. And my fear is people will have lost that sense of connection. They'll have lost, I should have made my third thing lost, not barriers. They'd have lost their family, they'd have lost incomes, security, work. And I think what we all know, and in fact in some of the most worst atrocities this world have seen, poverty and food scarcity and division and the blaming of others is what has sort of been the foundations to really, really horrendous acts and civil unrest. So I just paused because it said my internet was unstable. Am I back?
Yeah.
I've nearly finished. You'll be grateful. I think that might have been the warning system. Where did you get to, Flo?
No, I think we heard everything, but that you just started cutting out at the end. So just continue on, but just be aware of it. Yeah.
Lovely. So I just think we need to be really mindful going forward that there will be a recession. There will be a depression, most likely. I don't want to talk us into one. And actually, how can we support those people who, one, haven't experienced the benefits of this situation, but also those who have and might actually feel that they're on absolutely the opposite side again, as our communities and society may refracture. So I think that's a very sobering and sad note to end on, and I do apologise, but I'm worried. Thank you.
Yeah. No, thank you so much, Tracy, and really welcome what you've shared. I think that like we saw at the start of the call, over half of the people here are kind of really actively involved, and everyone here is passionate about supporting communities in this time of challenge. And it is a time of challenge, of course. Like you've said, it's very heartwarming to see the way that people have informally responded, and that's something to support and celebrate. And alongside that, it's very important to be aware of vulnerable people and, you know, people in harder situations as a result of this, of which there are many. And I think that everyone on this call would, well, I speak then from myself. I'm guessing many people on this call don't want to shy away from that we want to kind of acknowledge the context so that we can see soberly what's going on and really look at, okay, from this position we're in, being aware of all of the challenges and the facts on the ground, what can we do to support community wellbeing in this context? And one thing that, so we're going to move from Tracy's presentation into breakout discussions in a moment to give you guys a chance to speak with each other about this. But just to very briefly say that one framing that really helps me when facing wider times of challenge is this idea of active hope from Chris Johnston and Joanna Macy that some of you may have heard of, which is this idea that hope is not about kind of closing our eyes to the reality and the challenges. Hope is about taking action for the world we want to see whilst being aware of the world that we're in now. So I think the idea of supporting community wellbeing is not a kind of, often people assume well-being as a kind of soft, personal, somewhat light issue, but actually it's really about the kind of core needs of people in society to connect with each other, to support each other. So yeah, really welcome what you've shared there, Tracy. Thank you for feeding that into the discussion. So just to move on, thank you all of our speakers. Thank you, Karen, thank you, Ben, and thank you, Tracy, for sharing that range of experiences. It's been a really rich sharing from you guys, and I'm really happy that you're here with us for the rest of the event to share in the discussions and to answer people's questions later on. As I mentioned earlier, we really want to make sure you guys can interact with each other. So to start off with, just before we go into the breakout rooms, we're really aware that a lot of people on this call are doing amazing projects, are part of offerings or solutions, and we want to offer a chance for you guys to stay connected with each other, to see who else is here, and to share either links and, if you would like to, contact information. So what we've done is set up an open Google document, which I'm going to put into the chat box right now. So you'll see that in the chat box there is a link to a Google document. If you copy that link into your browser, you should be able to open up a Google document, which is a spreadsheet, which hopefully already has your name in it if the technology has served us well, but none of your contact details or information. And this is just an invitation, so it's by no means feel obliged to share anything, but what we've done is just included the list of names of people that have registered for this webinar, and if you would like to, you can share your email address or your website link or your Twitter handle or where you're based, or any notes or comments you'd like to share. And like I say, this is purely an invitation for you guys to offer you a chance to share links of things that you're working on in relation to this area and ways for people to stay connected with you, but do not feel obliged at all. And I'll leave that Google document link open throughout the rest of our discussion, so you can fill in the list of names is alphabetical by surname, if that helps you to find your name. And you can also Control F to find your name and add your details that way. And that will be open, yeah, for the rest of the discussion, and I'll send it around in the follow-up email. So don't feel if you're not immediately able to access or add, or don't need to get into a panic about it, but that's just a kind of offer for people there. Feel free to let me or colleagues know in the chat box if you're having any problems with that, but like I say, it will be available afterwards. So that's one way that we can kind of connect and interact. Another is to talk to each other. So we've heard 3 incredible presentations, very, about different contexts, but with lots of overlapping kind of lessons and rich sharing. What we're going to do now is split out into breakout rooms for small group discussions for about 10 minutes or so. And then we will come back together as a whole group for the Q&A with the 3 speakers and sharing any reflections that we would like to further as a group. So in the breakout discussion rooms, I would like to give you guys 3 specific points to discuss with each other, and I'm going to copy those into the chat box for your reference. I see, Amrita, you're not able to add your email, so I'll come to you and help you out with that in a sec. But yeah, the 3 questions that I'm going to invite you all to discuss with each other in the chat box. Firstly, just introducing yourselves. Sometimes you're in this big room, you're listening mode, and then suddenly you're in a small room with new people. So first of all, just maybe do a round of names and where you're from. And then just answering, have you been involved in any community work during lockdown yourself? No right or wrong answer there, but just to kind of share with each other. And then what lessons have you learned, or let's say what lessons are emerging, because as Ben accurately pointed out when we were preparing for this discussion, of course no lessons have been learned yet. These are very emergent lessons, and we're still in the process of learning them. But what lessons or observations have been emerging for you, either from community work that you're involved in or in general? And feel free in answering those questions in your small groups to reflect on what's been shared by the speakers and or to talk from your own experience. And you'll be in groups probably of about 3 or 4 people. Yeah, feel free to keep messaging me about the Google document separately, but for now I'm gonna split you out into breakout rooms. So you'll see in a second an option to go into a breakout room, and you just need to click yes, and then I'll just give you a little warning a few minutes before we're due to come back. But you'll have about 10 minutes in these small discussion rooms, and just I'll trust you guys to make sure that everyone's voice has the chance to be heard in those rooms. So enjoy the discussions and see you back here in about 10 minutes. So just to check in if anyone's still in the main room. I can see, maybe Emma?
Yeah.
Hi.
Can you hear me?
Yeah, I can, and I could see Danny as well. Are you in the main room, or? Oh, you've disappeared. Uh-huh. So just checking in if there's anyone in the main room anymore that wants to be assigned to a breakout room. If so, just let me know and I can assign you. Hi, Murdo, I see you've just joined.
Yes, there was a problem with the breakout rooms, so it's Flo. So the box just wasn't operational that I was put into. So it's.
Okay, I can assign you to another room so you can join in with the discussion.
Sorry for the gremlins.
No, not at all. I'll just you might just kind of go into a half discussion if that's okay with you, but I'll move you to breakout room 10 where there's
Could I ask you about the Google sheet? Do we email that to you once fill it, or how do we get it to you?
So I put the link in the chat box. So you can copy that link and then open it up in your browser.
I've done that. It's all ready for it. It's all ready. It's waiting for me.
I'll email you the link as well afterwards, so you'll be able to
send it to you. Get back to you. That's great. That's fine.
So I'll move you into a breakout room now. So have a good chat.
Thank you very much. Thank you.
It works this time. I say, hopefully. Okay, let me try again. Is it giving you an option to?
Stopped. No, it's nothing at all.
Okay, let me just try one. Sorry about this, Maddie. And what happened when you tried to go into the room?
There was a box, but it was like mostly black, and there was no picture. There was no picture coming on at all.
Okay.
And then it began to freeze, and it just wasn't.
Okay. Let's see. Just see if there's another. I think it might be because there's just one or two rooms that are just empty. So let me just see. Okay, I'll see if it's possible, and otherwise we can have a chat about the question.
We certainly can. I'll be quite happy with that, Flo.
Yeah, lovely. Okay, yeah, I mean, it doesn't seem to be working, so I'm totally open to that, because usually, you know what, usually I'm just like left here like, oh, I wonder how the chats are going. So it's actually quite nice to have the turn. Did you catch the questions? The kind of, maybe just starting with the introductions.
Yes, I managed to put some comments just on the chat box, and I found the chat box very useful because at times, although I love people, I'm not an extrovert, I'm more of an introvert.
Yeah.
And times you feel more shy, and then the chat box gives you the chance to you can sort of covertly put sort of stuff in without making a big noise about it.
Yeah,
you know?
Indeed. I totally relate to that.
and I'm quite soft-spoken, and so many people think I'm either Welsh, or you're from Isle of Man, or are you from Irish? Are you Irish? So,
Where are you from?
A lot of people are quite intrigued by my accent.
Yeah, indeed.
So I'm from the Outer Hebrides.
Ah, okay.
So the other end so in some ways Cornwall and us are quite similar. We're both living in extremities.
Mm.
So I still have daylight here. You know, the days last very long here in May and June.
Yeah.
You know, which is such a great thing. So it's
lovely. It must be a beautiful part of the world or the country.
It is. We have some of the world's finest beaches.
Yeah, lovely.
But there aren't many trees.
Okay.
There are mostly vast tracts of moor inland.
Mm-hmm.
But there aren't many trees. But the beaches and the hills really make up for it.
Nice.
So, yes.
And what kind of drew you to joining this evening? Have you been involved in kind of community response about yourself, or is it more an area of interest? Yeah,
well, I've run two big lunches at the village hall, and that was when I first joined the Eden Initiative. Mm-hmm. And I was at the community camp in 2015, mm-hmm. And I'm a very keen horticulturalist. Mm-hmm. I love gardening. So, and I've had mental health difficulties and challenges. Mm-hmm. And I think for me, gardening, it's been very therapeutic. Definitely, yeah. And I think the seed is a sermon in itself. Mm-hmm. and it's embryonic, and emblematic of life and the resilience of life, against all odds.
Yeah.
So many elements in garden, the metaphors really speak to me. It's on so many levels.
Yeah.
And being at the camp 5 years ago, it was really fantastic. And the accommodation pods there are really, there's some of the best beds I've ever slept in is the accommodation pods. They're really amazing, these pods.
Yeah. Yeah, no. I mean, so you mean, when you say the camp, you mean going to the Eden project itself?
Yes, I was at the community camp for all the volunteers.
I've seen that, but I haven't been.
Community camp, sorry, I wasn't very clear.
Yeah, no, so I haven't been. I've seen that a few times and always really wanted to go, but I haven't been able to directly attend myself. So it sounds
if you get the chance, I would strongly commend it to you.
Yeah, I would love.
And the pods, accommodation pods, where they're cabins, but they're so well appointed. The beds, we all slept very well, because the air quality is quite similar to our air quality. It's like coastal, the briny sea air, which is so good for your lungs and for your mental health, of course.
Yeah.
And my day job, I work for the NHS, so you can imagine that's what I'm dealing with just now. But although I'm a nurse by profession, I haven't worked in the front line for quite a few years, but I'm still registered. But I work in equality and diversity, and that's very busy just now because we're endeavouring to safeguard the rights of those who are vulnerable at this time, and those who are on the margins and feeling, rather excluded. So we're trying to advocate for the rights and the human rights of those who, such as the elderly, who might have do not resuscitate decisions taken about them without their active involvement.
Yeah.
But even their families being consulted. But also the disabled, who also struggle to find a voice too, and those with hearing impairments. And that's why what Tracy said about the need to be aware of those with sensory impairments, I was so pleased to hear that.
Yeah, such an important.
It's hugely important.
Yeah, so many important points raised by Tracy. Actually, I was really pleased to have her as a speaker, because Eden. Sorry, I'm just moving because I'm just realising my laptop's about to run out of charge, and that then everyone would get off. You're seeing the background technical preparation here, but it's so. Because the work that Eden Project Communities does is so inspiring, so it's so wonderful to have.
It's incredibly inspiring, and it's given that I live on my own, I've actually been working from home since the end of March, and my boss and I were actually in some trepidation about this because I've always needed to people around me.
Yeah.
But actually, it's actually gone much better than he and I could have hoped.
Right.
And I think it's confirmed that I am an introvert.
Yeah.
Maybe one should be more proud about that.
Yeah. No, it's really interesting that that some things can come out of this time that you think actually maybe that's more the way that I should be. Kind of some things make sense for you, like working from home a little bit as an introvert, or these kind of things. These are the kind of emerging lessons that you can learn on a personal level about yourself.
Very much so, and the time for me, but the timing was auspicious because I've just come out from a bruising experience at work, and I think the fact that I was given this chance, I think, showed some recognition on their part that I needed some time and space.
Yeah.
So, and I have quite a large garden outside, and that's been. I can go outside for my breaks, and the bird song in the mornings here is amazing, and that helps me too,
Yeah, the bird song is. I'm really sorry, but it's been about 10 minutes, and I'm going to have to.
Well, I was thinking that myself. Yes.
Yeah. So it's been lovely.
This has gone really. Yes. This has been the one-to-one is good for me.
Very wonderful. Well, it's just what we needed then. Both
absolutely.
So slowly everyone will start kind of.
That's fine.
But lovely to talk to you. Thanks.
Yes. Oh, and you, and you were very, very helpful with regard to the gremlins.
Yeah, it happens, and these technical things.
Oh, I know.
Always something.
So are you in Cornwall or in another part of England?
No, actually, so I'm just going to start to welcome, but I'll...
That's fine.
But welcome everyone that's joining back to the main webinar room now. I hope that you enjoyed your breakout discussions. Thank you so much for being part of that. It's always really interesting, I think, that transition from being in a larger space online to kind of having smaller close discussions. I actually had a really lovely one-on-one discussion with Murdo, so thank you so much. I hope I'm pronouncing your name correctly. Perfect. And I hope that you all had really brilliant discussions in your groups. Maybe at the bottom of Zoom, there's a reactions button that you can see. It's just a little smiley face. So maybe if you did find that an enjoyable experience, you can just either give a kind of thumbs up or just to give a quick reaction. Brilliant. Wonderful to see how helpful you guys found that. Thanks so much. And just to say, I know that a few people had problems with the entering their details into the Google document before. So please, if you've had any problems with that, don't worry. I'll send a link in the follow-up email, so people will have a chance to enter their details afterwards if they would like to and they haven't done so yet. So no worries at all. So yeah, I mean, I would really love to hear back from every single group, but given time, I think what we're going to do now is move on to the Q&A section of our evening, so that we can close on time at 9. So Roger, the Network of Wellbeing Director, has been hopefully keeping a close eye on all of your discussions and questions in the chat box. And I'm just going to ask Roger to give a summary of maybe some of the key themes or key questions that are coming out of the chat discussion this evening, so that Roger can then feed those into the speakers and we can ask the speakers some of the questions that you guys have been sharing. So Roger, are you able to unmute yourself and join?
Yep. Hello, Flo, and thanks for that. Yeah, really interesting bunch of questions. Not a huge number considering the number of people we've got, so maybe there's room for some more if people want to quickly put them in the chat box. I think the biggest question that three or four people asked, which is what's going to happen in the future? Is this going to last? And how do we prepare communities for the changes that are coming out? Isla said, during this time, we've seen the effectiveness and the value of localism with partnerships formed at local level. How do we ensure we don't lose this as we move forward? How can we ensure policy and mechanisms that enable and support community solutions actually last? Michelle, I'm really interested in whether the community engagement momentum will last. How soon will it be before people become less tangibly able to respond in the same way? Will everyday people still want to help each other? Similarly, Daphne, what happens when restrictions are gradually lifted, volunteers are going back to work? How do we equip community groups to continue to deliver their essential food delivery and wellbeing services? That's the big one I think people were asking.
Great, thank you, Roger. So kind of handing back to our three speakers, Karen, Tracy and Ben, do any of you want to come in on those questions that Roger has shared in that initial round?
Yeah, I'm happy to, Flo.
Great,
actually. I honestly think that it's going to get worse for our communities, not better. I think that we're, as I was kind of saying in my piece, really, I think that we're heading into more difficult times, even in terms of the economy. I think that what we can do to prepare communities is to focus on building resilience and to focus on supporting the community energy that's come out. Somebody in my group said about not being frightened of bureaucracy, and I thought that was beautiful to sort of put it that way. And actually, you know, I think it was Kirsty, wasn't it? And actually, it's that thing, isn't it, about actually we've shown we can build a hospital in a couple of weeks. We've shown that actually when it comes to it, there is money somewhere for some of the stuff that we need. And we've also seen, I think, that people who have got resources are more willing to share them. And actually, I was noticing on the debate about volunteering, you know, lots of people talked about people's frustrations at having to wait for volunteering placements while organisations did DBS checks and the like. You know, actually, what that says to me is there's a lot of willingness, but people are still not really sure how to direct themselves into making society better as a whole, but there's still that desire to. So will it last? I think depends on how the state and the sort of the system responds. And we've been looking at this a lot through system leadership and through that notion of sort of distributive leadership. You know, the idea that you would share, you would share the power, and you would sometimes be the lead goose, and sometimes you'd be the goose at the back of the flock, just flapping along with everyone else. So I definitely think there are things that we can do to build resilience in our communities, but you know, without wanting to really depress everybody, my personal view is that it's going to get incredibly difficult internationally, and those at the bottom of the pile in the system, you know, those that don't have access to things, will find that it becomes even worse more quickly. And my fear is that those communities don't have the resilience. COVID's shown us that actually there are ways of the community stepping into that space and answering its own problems. So I think that's what we need to build on.
Mm-hmm.
Thanks so much, Karen. And Tracy, I see you'd like to add to that.
Yeah, it's not my quote, but I was thinking about the quote from Margaret Wheatley that says, there is no power for change greater than a community discovering what it cares about. And I just think if we can tap into that, what community cares about, and really support those communities and give them the resources in order to look at what they care about, I think that will help. I absolutely agree with Karen. I think it will get worse before it gets better, and I will have active hope, because that's what I do, but I am also very sort of pragmatic and realistic, and I do think we will have to work hard at it, and we will have to work hard at protecting those informal connections, because what we will see as people looking for solutions, they will want to formalise them. Just as I've been around this world a long time, we've seen the formalisation of the voluntary and charity sector into now the third sector. I can see people will see this wonderful resource and look at how they can help it to fill the gaps. And what we need to do is help those people that have stepped forward and want to care and look after their community genuinely get the power and the decision making that goes along with that responsibility and the resources. And I think that will take us all to get behind that, and it's not an easy road to go down.
Yeah, thank you, Tracy. And Ben, would you like to add anything to Karen?
Yeah, I mean, there's not a huge amount to add to what Karen and Tracy put on there, but I think, yeah, I think it's about recognizing, and we've seen this really, recognizing the things that community can do that the state can't, and providing the support and the resources, enabling that to happen. And we had a really cut short discussion in our group just then around that theme of sharing power, and where certain instances where you'd had that rapid community response and they'd been absolutely enabled, and you had the infrastructure of local government behind them supporting them, and other instances where council come in and maybe tried to take control of the situation and completely stifled what was happening. So I think it's about creating the conditions that enables this, enables it to happen, and maybe a little bit in there as well about identifying some of the barriers that we've taken away that have allowed this to flourish, and just saying, you know, look what happens when we do take away some of these barriers and enable community action.
Thank you, Ben. And yeah, I can imagine that a few people's conversations got cut short in the breakout rooms, and definitely we'd love to see this evening's event is part of an ongoing discussion between people here and people beyond this event as well. And so just in case people missed it in the chat, I will be I know that a lot of useful responses and links have also been shared by all participants in the chat this evening. So I'll make a copy of the chat and send that around in the follow-up email as well, just so that you've got that as a resource in addition to the Google document to help people stay in touch. So we want to go, I think we'll have time for one more round of questions from Roger, and then we're going to go to each of the speakers for just a final word before we move to a close. So Roger, a final round of questions?
Yeah, I mean, I think the other thing that's coming out is, how do we reach people who are difficult to reach? I mean, questions about how we get to people who are digitally excluded, isolated individuals from Penny. Questions about how do we represent the voice of the people who are shielding for a lot longer after lockdown from Ellen. And so how do we reach people who are difficult to reach and make sure those people who are isolating are actually represented in our discussion?
Thanks, Roger. Would any of our speakers like to come in first on that, Karen?
Really practically, that's a discussion I was having with Sport England the other day about, you know, some of what we're picking up from our community, individuals in our communities, is that even when lockdown is lifted, they're not going to want to go shopping, they're not going to feel safe to go out in the community, they're not going to want to join in with the social life they might have had before. And one of the things that we've been talking about is using our befriending service, where we're finding this kind of information out, and then linking that to some of the volunteers, and setting up an actual befriending where people might, you know, first of all, somebody might go to somebody's house, have a cup of tea, get to know them a little bit. A couple of sessions later, they might take them to the shops or to a community lunch or whatever they would have normally gone to, and it perhaps over a period of weeks might get them to the point where they've overcome those anxieties and are less fearful and able to do it for themselves. Now, that sort of model is stuff that we've done with people recovering from chronic conditions, or people with mental health, chronic mental health issues. I think actually there's going to be a whole group of people that will have been impacted on with anxiety around COVID, and we're particularly thinking in Birmingham about how this impacts on some of our BAME communities, whose risk is going to be greater anyway when they engage back in the community. So how do we work with those communities and to kind of provide that sort of befriending link up so that people can actually come out with support for the first few times? So on a really practical level, we're looking at joining up what we know with some of the resource we've got to see if we can help people overcome that in a one-to-one type setting. But that's going to be incredibly resource intensive. It's not the kind of thing that our strapped local authorities and adult social care are going to have a budget for necessarily. So we're going to need to be innovative and find other ways to attract funding, I'm thinking.
Great, thank you, Karen. Tracy and or Ben, you're
yeah, I can go. I mean, I think, yeah, that's a really difficult question. How do we reach the people that are really hard to reach? But I think the answer, again, and we're sort of seeing that in a lot of these big national responses, is that the resource that they're using to reach, you know, people who are shielding, who are at risk of digital exclusion in Scotland, for example, they're going through the most local grassroots organisations in order to do that. And I think that's what we've been talking about all of this evening, and that's where the answer is, because that's where they have that depth of like connection and understanding of people. And there's some really amazing creative and diverse things happening too. I think the other thing on, like, there's something really important about language and sort of engaging a little bit of like emotional intelligence in the way that we talk about post-COVID, because we know that there will be, you know, some people who are continuing to shield for a lot longer. We know there will be like thousands and thousands of people who are bereaved, for whom like being able to, you know, go out to the pub or to a cafe is not going to be a cause for celebration, because they're still dealing with that emotion. And I think that needs to be reflected in the way that we talk about it as well, and just sort of thinking about that sort of language and compassion and humanity, I think.
Yeah, thanks so much, Ben. Really important. And Tracy?
Yeah, I was just picking up, I was going to say something similar, because I was going to be a bit provocative and challenge the hard to reach statement, and someone said sort of seldom heard. I don't think anybody really is hard to reach. I just think there's limited resources, you know, so there is actually a prioritisation, and I think we show in any situation that we can reach people should we have the time the will and the energy to do that and believe that there's an outcome. And I think that's what we have to bear in mind. I've got some rather cantankerous neighbours. None of them are hard to reach. I can reach them all. It just takes my time and dedication and to finding what they care about and some common ground. And I think it's easy to label, and we all do it. We slip into that professional language. And I think what we have, it is the time and resources and the will to do it. And of course, the priorities that we are incumbent on us, we cannot do everything. So I think that is our challenge, not people being hard to reach, but how do we prioritise the people we reach out to?
Yeah, thank you very much, Tracy. And this is why it's been really valuable to hear from the three of you this evening, to share your wealth of experience in kind of dealing with these issues and getting to the nuance of what's behind kind of working with different people in communities. So we have about 3 minutes left. So I'm going to offer Karen, Ben and Tracy quite a challenging proposition to give just a kind of sentence or two, maximum minute, just a kind of summary of your either key message takeaway or key action takeaway that you'd like to leave the group with this evening before we close. So I'll hand to Karen first.
Thank you. I think for me, it would be, I'm going to pinch one of the 5 ways to wellbeing really, and I'm going to talk about noticing. And I think in the middle of chaos and sort of that kind of fight or flight response that we all get, you know, when the cortisol levels are really high, I think we can kind of rush in to act, and that's really, it's been really important that we've done that. But I think, and it's really the theme for me of this evening, there's something very important about noticing where the energy is coming from, noticing where the people are, where the people aren't, and I mean it in the widest sense, not just in ourselves, but in our communities. So I would encourage people to notice, you know, notice what has happened, but also equally notice what hasn't happened. And I think there, for me, some of the lessons for us to take away are as much in the things that haven't happened as the things that have. So I'm going to encourage you all to notice.
Thanks so much, Karen. And thank you, Marilla, for putting those 5 ways to wellbeing in the chat box for people that hadn't heard of those before. Ben or Tracy? Ben, would you like to go next? Oh, you're muted. Sorry, Ben. I'll unmute.
Apologies. It's been a long day. I guess I would have thought about something similar, but I think there's something about reflecting on what is happening now and what we really value in our relationships, in our personal relationships, our communities, our professional, whatever it is, and for me, and in that kind of like popular narrative, it's all characterized by kindness and humanity and connection, and to really think about what we can do now to make sure that these are the things that sustain through this crisis, because I think, as everybody has said, it is going to get harder, and we are going to need to make sure we hold on to this in the weeks and months ahead.
Thanks so much, Ben. And Tracy?
Thank you. I just think, I just want to reflect before I go any further just on why I love community work. It's amazing being in a space, virtual or real, where there's so many people that are passionate and sort of like-minded and trying to put people first. It's like coming home. So I just wanted to say thank you before I go on. And there's 2 sort of takeaways, I think, for me, and they're old school, they're nothing new, and I just think they become more and more sort of heightened for me. One is the old dilemma between what's urgent and what's important. Do you know what I mean? So Eden Project set up Eden Project 20 years ago when the environment was important, but it wasn't urgent to many. It now is. You know, the community outreach, you know, and we will get forced to prioritise what is urgent and not what's important. And I think we must remember that, and that also feeds into that prevention and that measurement. We will get forced to do what we can measure, not to do what needs to be done, and to be in that preventative space because it can't be measured. So how do we hold, this is why I love the informal world, how do we hold on to that preventative important stuff? And it's that bridge building in that space that helps people build trust, relationships, that then helps them to become resilient and well networked. And I think those stepping stones need to be kept in place. And just to reiterate Karen's point, we must look at the light, but we must look at the dark side, and the yin and the yang. And whereas I will often be in that positive, look at amazing communities, what they will do, what I will take away is I will also share an example of someone I know who is not having that experience, you know. And usually either I'm fortunate or unfortunate, I can share a personal story about that of a member of my family. And I would encourage people to do the same, because the biggest barrier that we will come across is when we start othering people. And we are all people, and we all have personal experiences. And I think if we can all continue to bring our person to this debate and this issue, we'll make greater strides forward.
Thank you. Thank you so much, Tracy and Ben and Karen, for such powerful final words to bring us to a close this evening. And thank you all for being such engaged and wonderful participants, for sharing so warmly and openly in the chat and in the breakout rooms and in your connections with each other. So we will follow up with an email with the recording and the links and ways to stay in touch. But for now, I'd just like to draw us to a close and invite everyone to write a message in the chat to say goodbye, and or like just wave at each other as you sign off, just so that we know that we're all here together as humans. We've all been here connecting to to see how we can support each other in community. So goodbye everyone, and thank you so much for taking the time to join.
Bye.
Bye.
Cheery.
Bye.
Cheery, bye.
Virtual hugs to
Bye,
everybody.
everyone.
Goodbye.
Thanks, everyone.
Bye, thank you.
Bye-bye.
Thank you.
Lubiano, come of Savage, cheery.
Oh, bye,
Bye all.
Thank you, Flo. Thank you, everyone.
Lubiano.
Thanks so
Goodbye.
much.
Thank you, everyone.
Thanks
Bye
again.
now. Bye-bye.
Bye, Flo.
you. Bye-bye.
Thanks, everybody. Thank you.
Bye bye.
Oh.
Yeah, we're all her friends.
Oh, yeah.
Ah, right. She is my best friend.
Thank you.
Thanks so much.
Bye, Jess. Love you. Miss you.
Bye.
Hi, nice to see your face.
Yes, thank you, darling. It's nice to see your face too.
Speak to you soon. Bye.
Bye, darling.
What was that?
I was just going to let everybody know we used to work together, and I miss you so.
I'll speak to you soon.
Yeah, stay well, darling.
Bye.
Stay well. Bye.
So I'll be in touch with you guys, Tracy and Karen, then. But thank you so much again for this evening. It was really.
Thank you. Thank you again for your organisation. It was lovely to be part of it. Thank you for
Wonderful.
the invite.
Yeah, thanks so much.
Thanks. I really appreciated it. Bye.
Thank you, Karen. Bye.
Bye.